Hi viewers, this is Dr. Rajni Kanta. I'm an eye specialist and today's topic is going to be a very interesting topic. What is cataract? People ask us, when the moment they hear about cataract, they have different opinions about it. Some people are scared, some people are not scared. They'll say, no problem, my father had a cataract surgery, my grandfather had a cataract surgery, my great-grandfather had a cataract surgery. So we are not worried about that. I'm sure the surgeries will go off well. So when they come, we explain to them what is a cataract. All of us have a lens inside the eye, which is crystal clear. And as we grow older, like how our black hair becomes gray at the age of 40, 45, it starts graying. Like that, this natural lens, which is crystal clear, slowly becomes gray or white or brown. It becomes a little opaque. It is not truly 100% transparent. And that is what is a cataract. It is not a new tissue growing inside the eye or new membrane growing inside the eye. Many people are under that impression that it's something external and we have to just strip it off. It is not like that. The lens which we have inside the eye, instead of being transparent, it becomes opaque or hazy. That is what is a cataract. So there are babies also born with cataract, what is known as congenital cataract. That is, they're born with it for various reasons, and they bring the child to the doctor saying the pupil, the black portion which we see, that is white in color, and the baby is not able to fix the eye, not able to look at us, not able to respond to any toys or anything. So then we look at the baby's eyes and we find that there is a congenital cataract. Sometimes, even younger people get it. That is, people who are in their 20s and 30s, and that is known as juvenile cataract. Sometimes people who are on some medicines for a long time, which may be required for them, like steroids. Steroids are given for rheumatoid arthritis, for so many collagen disorders, and so many. Only if it's required, it will be given. And when they take it for many months or years, they develop this steroid-induced cataract. So cataract is not only because of age, it can be due to so many other reasons. And even a trauma. They'll come and say, yesterday this injury happened. That is something hit the eye, or some sharp object when they're in some industry, it can happen. Road traffic accident, it may happen. When something goes and hits the eye, you can develop a traumatic cataract. That is something due to trauma. So cataract is of different varieties, and we assess the type of cataract, what is the type, why it happened, and then we can remove the cataract and put in a intraocular lens. Before we do that, we don't put the same lens for everyone. We have to do a calculation, and we have some biometers available for that. And we use those equipments to find out the curvature of the cornea, the length of the eyeball, and many other features we see. And then the machine calculates and tells us, it's an ultrasound machine. It tells us what is the power we should put inside, what is the type of lens, and then we buy the particular intraocular lens and then we put them inside. And even intraocular lenses are of various varieties. They are foldable intraocular lenses. Then we have extended wear intraocular lenses, and then we have toric lenses. So many varieties are there. So we give them the choice. Would you like to have this or this or this? Or we sometimes choose ourselves and we guide them. For your particular eye parameters, this will be the ideal type of intraocular lens. And then we buy that particular lens and we remove the cataract with laser or with ultrasound phaco machine. Phaco machines are there. We can use that very rapidly. Within 8-9 minutes, we can do this procedure. And then we replace that normal lens which has become cloudy. We remove that and put in this intraocular lens. It is not at all painful, totally painless, and nowadays we do with just drops, eye drops, which makes the eye numb, and within 8 minutes or 9 minutes the procedure is over and the person can go take the instructions and go home immediately. So these are all, so nothing to get worried or perturbed when someone tells you have a cataract. But please do something, especially people who are 50 and above. As you watch television or you're watching the laptop or your cell phone, please close one eye and see what is the vision in one eye. if you're wearing glasses, please wear the glasses. Put the glasses on, close one eye and see what is the vision. Close the other eye and see what is the vision. Sometimes one eye vision will be dropping and the person may not be aware of it at all. And in that case, if you do this check once a week or something, or any number of times you can do it. And when you find that one eye, the vision is dropping, please do come for a checkup. It could be a change of glass power. It could be a cataract. It could be some other problem also. So please do check up with your eye specialist to find out what is the cause for this diminution of vision. So nothing to get worried if there's a cataract. It is easily treatable and it's for a lifetime. So we also take a lot of precautions. We calculate correctly, put the correct lens inside the eye, and the person is very happy for a lifetime. I hope this was an interesting program. Thank you so much.